Johns Hopkins Medicine is apologizing after a controversial email about privilege that singled out groups of people. Fox 45's Jessica Babb takes a closer look at how Johns Hopkins is responding.
Johns Hopkins Medicine is now walking back the internal email that was sent out, saying it doesn't reflect their values.
I think it's an extremely difficult conversation to have.
A difficult conversation about diversity and privilege.
I think it makes Johns Hopkins look bad.
Johns Hopkins Medicine is responding to controversy after this email was sent out, saying people who are white, able-bodied, heterosexual, cisgender, male, Christian, middle class, middle-aged, and English-speaking have privilege or unearned benefits, even if it's invisible to them.
It looks pretty normal to me. Maybe they could have phrased the first couple sentences or softened it a bit, but it's standard discussion.
I can see why it sparked some controversies. Could have been worded a little bit differently, but again, it's a very difficult conversation to have regardless.
One of the problems with Johns Hopkins doing this and sending out this memo is that you create an uncomfortability and you stigmatize those who are mentioned as the beneficiaries of privilege. And I think that's a bad idea.
In a statement, a spokesperson from Johns Hopkins Medicine says the January edition of the monthly newsletter from the Office of Diversity, Inclusion, and Health used language that contradicts the values of Johns Hopkins as an institution. Dr. Sharita Golden, Johns Hopkins Chief Diversity Officer, has sincerely acknowledged the mistake and retracted the language used in the message.
When you claim now, in January of 2024, that there's a critical issue of discrimination against all people except those who are white and heterosexual and cisgender, I think you communicate a message that is it's out of touch with reality.
In a message, Golden says the intent of the newsletter was to inform and support an inclusive community, but the language used didn't meet that goal, saying it was overly simplistic and poorly worded, being exclusionary and hurtful to members of the community.
It's not really a matter of pointing fingers and you're bad and damned because you have privilege. It's more so being cognizant of the ways we have advantage over others.
Golden said moving forward, she will work to ensure future messages meet their organizational values. Jessica Babb, Fox 45 News.
Congressman Andy Harris is reacting to the controversy, calling on Hopkins to fire the individual. In a statement, the congressman said in part, quote, "This kind of woke discrimination has no place in modern healthcare and science. This blatant discriminatory sentiment is contrary to all the principles held dear in America and certainly not expected from an institution that receives hundreds of millions of dollars in funding from the federal government, including dollars to fund that Office of Chief Diversity Officer. The only appropriate action on the part of Johns Hopkins Medicine is to fire that individual immediately."